Okay, this video is going to be about the endocrine glands, which is going to be chapter 20, I believe. So we're going to start off with just describing the endocrine gland's general characteristics, and they are going to be the fact that the endocrine glands are ductless, and they secrete directly into the bloodstream. So there's no other pathways. They just go directly into the bloodstream. And since it secretes directly into the bloodstream, it's going to be working on distant cells. So there's 3 types of glands in the endocrine system. They're going to be paracrine, juxtacrine, and autocrine. So starting off with paracrine, it specifically affects local cells, and the hormones that it releases get released into the interstitial fluid. Juxtacrine affects adjacent or to the side, the lateral, if you want to talk anatomically. It affects like the adjacent lateral cells. And autocrine affects the secreting cell itself. Also, these should all be A's. That's bad English on my part. So starting off with the first gland, it's going to be the pineal gland. And this is a really simple gland, but it's a very important one because it has to do with one of the most important biological functions that we have, which is sleep. So the pineal glands, they secrete melatonin, which is the hormone that makes you sleepy. And the melatonin is secreted via cells known as pinealocytes. So if you can't really tell what melatonin does, it's kind of self-explanatory, but just to sum it up, melatonin regulates sleep cycle and circadian rhythm, which what that is basically you have different phases of sleep. You have stage 1, stage 2, stage 3, and REM sleep, which is rapid eye movement sleep. REM sleep is when you're in your deepest state. First and second are when you're very easily wakeable. And REM sleep is when your body actually undergoes the process of repairing itself. And melatonin is the hormone that kind of regulates that circadian rhythm. The next gland is the pancreas. This is a very, very, very important part of the body. So you've got 4 different kinds of hormones being worked around in this system. Alpha being glucagon. And what glucagon does is it raises your blood glucose levels. And then you've got beta, and these are Greek symbols. Beta is going to be your insulin hormone, and insulin does the exact opposite of glucagon. It lowers your blood glucose levels. And I don't know if they're going to ask this, but a normal blood glucose level is going to be around 70 milligrams per deciliter. And then for delta, it's going to be somatostatin. And what this does is it lowers the secretion of insulin and glucagon. So it kind of regulates the above aforementioned hormones. And then finally, you've got, we're going to just label this as PP. You've got pancreatic polypeptide. Now what this does is it works at a more of a macro level, and it regulates pancreatic secretion. So if we were to just go in order of magnitude, these two are kind of just like the base level hormones that regulate responses in the pancreas when it comes to blood glucose levels. And then somatostatin is the one that regulates both of those, and pancreatic polypeptide regulates the entire system. Next gland we've got is the pituitary gland. And we're going to start off by just naming the basic components of it, and then we're going to go into a bit more of a deep dive afterwards. So the pituitary gland actually, it controls all other endocrine glands. And it's got two parts of it, basically. Let's see here. So the anterior part is going to be the adenohypophysis. And the posterior part is going to be the neurohypophysis. we can go to another page. So we're going to start off with the adenohypophysis. That's the anterior. We're just going to abbreviate that as A. So this has 6 hormones working in its system. And the basic structure of the adenohypophysis is 3 parts. So the pars distalis is one part, and this is going to actually make up 75-ish% of the adenohypophysis. And then you've got the pars tuberalis. And then you've got the pars intermedia. Now, the pars distalis, it contains all of the cell types above. And that's pretty much the simplified version of it. And the pars tuberalis, it contains gonadotrophs. And the pars intermedia contains corticotrophs and chromophobes. Now, I'm going to just label adenohypophysis again because we're going to talk a little bit more about the different kinds of cells. Different kinds of hormones and the cells, I guess. Now, you're going to start off on the adenohypophysis with the chromophils. And then this splits up into 2 parts. It makes up 2 parts. So one side is going to be the acidophils, and the other side is going to be the basophils. Now, the basophils release 3 types of trophs. They release corticotrophs, gonadotrophs, and they release thyrotrophs. While the acidophils releases 2. Just lactotrophs and somatotrophs. So obviously, as you would think, lactotrophs release the hormone known as prolactin. Somatotrophs release growth hormone. We're just going to abbreviate that as GH. And then corticotrophs release, and this is kind of a long one, so I'm going to type it up here. So it's going to be adrenocorticotropic hormone. So corticotrophs release adrenocorticotropic hormone. And the abbreviation for that is going to be ACTH. So the gonadotrophs, they release follicle stimulating hormone. Or FSH. And the thyrotrophs release thyroid stimulating hormone. Or TSH. And a good way to remember all of these, except for the acidophil side, at least on the basophilic side, the hormones related to the different kinds of trophs are going to be very similar to the names of these trophs they represent. So, moving on to the neurohypophysis. So this is going to be comprised of only 2 hormones. And the blood supply for this is going to be the hypophyseal artery, and the neurohypophysis, it secretes oxytocin and ADH plus. Just a few things about it secreting. Its secretions are produced in the hypothalamus and it's stored in herring bodies. So oxytocin is going to be produced by the paraventricular nuclei. And what it does is it stimulates smooth muscle contractions in the uterus for women during childbirth. During childbirth. And ADH is going to be, I'm actually going to put that this way. ADH is going to be produced by the supraoptic nuclei, and it deals with water reabsorption. Now, the neurohypophysis anatomically, it's connected to the hypothalamus via the hypothalamus hypophyseal tract. tract. And it consists of the infundibulum, and the pars nerviosa. And the pars the pars nerviosa is going to be the main part of it. Containing hormones. And the main cell type for the pars nerviosa is going to be the pituocyte. Now moving on to the next gland, we're going to be talking about the adrenal gland. So the adrenal gland is made of two parts. The adrenal medulla and the adrenal cortex. So the adrenal medulla, it's stimulated via the sympathetic nervous system, and it is based of the main cells are going to be chromaffin cells that are specialized for secretion. And the adrenal medulla, it secretes adrenaline and noradrenaline. And again, this is all happening because of stimulation from the sympathetic nervous system. So, adrenaline increases your heart rate, dilates your blood vessels to increase blood flow to your cardiac and skeletal muscles. While noradrenaline is the opposite. It lowers blood flow. Well, it's not really the opposite, but it kind of works in tandem with it. It lowers blood flow to your GI tract. And it specifically increases blood flow. Increases blood flow to the brain and muscles. So in a fight or flight situation, you're not really going to be focused on digesting your food, and neither is your body. Your body's going to be focused on getting the hell away from that situation. And that's why adrenaline, it prioritizes the muscles and the parts of your body that are going to be crucial to making sure you survive. So the adrenal cortex, it's stimulated by ACTH, which is the hormone we talked about, adrenocorticotropic hormone, from the anterior pituitary. Yep. And so the structure of the adrenal cortex, it has three parts. It has the zona glomerulosa, and it has the zona fasciculata, and the zona reticularis. Now, when it comes to percentages that these make up of the adrenal cortex, zona glomerulosa makes roughly 15%. Zona fasciculata makes roughly 75%. And the zona reticularis makes roughly 10%. And the zona glomerulosa, it secretes mineralocorticoids, such as aldosterone and it works in water and sodium ion reabsorption. While working in tandem with potassium ion loss. And this all happens in the DCT of the nephron. This is the zona fasciculata. It secretes glucocorticoids. Such as cortisol, the main stress hormone. And basically what it does is instructs the anterior pituitary to stop release of ACTH. And the zona reticularis this secretes androgens. So in females, it increases libido. And in males, it increases male characteristics. We're just going to say traits. And then finally, we've got the parathyroid and the thyroid glands. So we're going to start off with the parathyroid. So, parathyroid. So the parathyroid gland is comprised of 4 glands. And they're found posterior to thyroid. So the main cells for the parathyroid gland are the principal or chief cells. And they secrete parathyroid hormone. So what parathyroid hormone does is it actually does a couple of things. When parathyroid hormone is released, it increases your blood calcium levels. And what this does specifically is it stimulates osteoblasts to secrete osteoclasts, and stimulating factor which results in an increase in bone reabsorption. And the blood calcium levels also result in an increase in the calcium ion absorption in small intestines. And also, it increases reabsorption of the calcium ions, calcium 2+ ions, in the DCT of the nephron, or the kidneys, DCT of kidneys. And last but not least, we've got the thyroid glands. Now, this is a very important gland as well. It's probably one of the most important in the endocrine system. So the thyroid gland is bilobed, and it's joined together by the isthmus. And so its main cells are going to be the parafollicular cells. Which secrete calcitonin. Calcitonin does the opposite of parathyroid hormone, where it decreases the blood calcium levels. And the thyroid gland contains follicles, which is comprised of a circle of thymocytes, and this is going to be stimulated by thyroid stimulating hormone, which is from the anterior pituitary gland, as we talked about previously. And this occurs in the lumen. The lumen in the middle is called the colloid. Now, the colloid specifically contains thyroglobulin. Now, what is thyroglobulin? It is a precursor to the thyroid stimulating hormone, which is important. Now, for the thyroglobulin to get activated and become an active hormone like the thyroid stimulating hormone, it needs to undergo iodination. And specifically what needs to get iodinized is the tyrosine residues of the thyroglobulin. And that is what produces the active hormone. Now, the main hormones of the thyroid gland, thyroid hormones, are going to be triiodothyronine, triiodothyronine, also known as T3, and this is going to be the more active hormone, and its half-life is 1.5 days. Now, while triiodothyronine is going to be the more active hormone, thyroxine, or T4, is going to be the more abundant one. And its half-life is 1 week. Now, what do these basically do? These thyroid hormones, they control your basal metabolic rate. And again, going more into the iodination process, thyroglobulin, it needs to undergo iodination. So thyroglobulin is going to be specifically for the TSH precursors, and it needs to undergo iodination for it to become an active hormone for TSH, whereas thymoglobulin, so specifically for T3 and T4, thymoglobulin needs to also undergo iodination and cleavage to form T3 and T4. And iodination, it needs iodine. And that is the endocrine system. I don't know how long the immune system is going to take, but I don't even know if I want to make that. We'll see what happens.